Have you ever had a vertigo attack that was so frightening you thought you were dying? Maybe the room suddenly started spinning, your heart began pounding, your breathing became fast, your hands got all shaky and sweaty, you felt nauseous, and within seconds, you weren't just dealing with the dizziness anymore. You were having a full-blown panic attack. If that's happened to you, I want you to know something that might completely change how you think about these episodes. For many people, it isn't actually the spinning that becomes the biggest problem. It's the panic that follows. In fact, once panic takes over, it can actually make your dizziness feel dramatically worse, trapping you in a vicious cycle that's incredibly difficult to escape. But here's the encouraging news. There are 2 simple techniques that I frequently recommend to patients that can help interrupt the panic response, sometimes in as less than a minute. They're easy to learn. You don't need any equipment, and you can use them almost anywhere. But perhaps most importantly, once you understand why they work, vertigo often becomes much less frightening because fear grows in uncertainty. Understanding replaces uncertainty with confidence. Before this video is over, I'm also going to explain one of the biggest mistakes almost everyone makes during a vertigo attack that unknowingly keeps their brains locked in panic mode, even after the spinning has started to improve. Knowing that one mistake alone could completely change how you respond to your next vertigo attack. I'm Dr. Matthew Posa. I'm an upper cervical and neurostructural chiropractor in Milton, Ontario, Canada. Over the years, I've had the privilege of helping thousands of people suffering with dizziness, vertigo, balance disorders, neck-related conditions. One thing I've noticed over and over again is this. Most people aren't just afraid of dizziness anymore. They're afraid of what the dizziness is going to do to them. They're afraid of driving. They're afraid of grocery shopping. They're afraid of going to church. They're afraid of traveling. They're afraid of being home alone. They're afraid that they'll have another attack, maybe in public. Eventually, life starts getting smaller. Not because the vertigo itself, but because of the fear that surrounds it. If that's where you are today, I genuinely hope this video helps you. To understand why these techniques work, we first need to understand something fascinating about your brain. Imagine you're driving using 2 different GPS systems. Normally, both GPS units agree exactly where you are. Everything works perfectly. Now imagine one GPS suddenly says that you're turning left, while the other insists that you're turning right. Immediately, you stop trusting both of them. Your brain experiences something very similar during many types of vertigo. Your eyes are sending one message, your inner ear is sending another, and sometimes your neck is sending a completely different set of information as well. Instead of 3 systems agreeing, they begin arguing with one another. Your brain suddenly receives conflicting information about where your body is in space. And here's the important part. Your brain doesn't like uncertainty. From an evolutionary standpoint, confusing sensory information often meant danger. So rather than assuming everything is okay, your brain assumes the opposite. It activates your emergency alarm system. Within seconds, your sympathetic nervous system, your fight or flight response takes over. Your heart races, your muscles tighten, your pupils begin to dilate, your breathing becomes quicker, adrenaline floods your bloodstream. Your brain becomes hyper-focused on survival. This is why so many people think they're having a heart attack or a stroke or that they're about to collapse. What's happening feels incredibly real because your body's alarm system is behaving exactly as though you're facing a life-threatening emergency. But here's what many people don't realize. Once this panic response begins, it starts making the dizziness itself feel worse. Not because the underlying vertigo suddenly changed, but because your body's response to it changed. And that's where these techniques become incredibly powerful. They don't necessarily stop the cause of vertigo. Instead, they help stop your body's emergency response from pouring gasoline on the fire. The first technique is my favorite because it's incredibly simple. It's easy to remember during a stressful situation and almost anyone can do it. It combines something called the P6 acupressure point with box breathing. Now, before I show you exactly how to do it, I want you to make one promise to yourself. Don't wait until the next severe attack to learn this. Practice it while you're actually calm and you don't have an attack, because when panic hits, your thinking changes. So it's like you're training yourself for an emergency situation. Your brain doesn't learn well during survival mode. It remembers what you've already practiced. So let's learn it together right now, and you can do this with me as you're watching the video. Now, before I walk you through the first technique, I want to tell you something that surprises almost every patient I see. Most people think they're trying to stop the spinning, and I understand that, but they're not. What they're really trying to stop is the fear. Think about it. If someone told you with complete certainty that your vertigo would last exactly 2 minutes and then disappear, you'd probably still dislike it, but you wouldn't experience the same level of panic. Why? Because certainty reduces fear. The unknown is what makes your brain sound the alarm. That's why understanding what's actually happening inside your body is so incredibly powerful. Knowledge doesn't just educate you, it gives you back a sense of control. And that's exactly where we're trying to accomplish with this first technique. Not necessarily stopping your vertigo, but preventing your nervous system from escalating into something even bigger. Here's an analogy I often use with patients. Imagine the smoke detector in your home. When it senses smoke, it does exactly what it's designed to do. It sounds the alarm. The problem is, sometimes the smoke detector also goes off because someone burnt the toast. The alarm is real, the sound is loud, your heart still jumps, but your house isn't actually gonna burn down. During many vertigo attacks, your brain can behave in a very similar way. Confusing balance signals trigger an alarm. Your body responds appropriately to what it believes is an emergency, but the intensity of the alarm doesn't necessarily match the true level of danger. Our goal today isn't simply to stop the alarm. Our goal is to show your nervous system that it's safe to begin calming down. Once that happens, your brain has a much easier time processing the balance signals that it's receiving from your eyes, your ears, and your neck. One of the biggest mistakes people make is trying to force the spinning to stop. They become frustrated when it doesn't disappear immediately. Instead, I want you to shift your focus. Ask yourself this question: what if I could stop the panic first? Because when panic settles, everything else becomes much easier. The two techniques I'm about to show you work because they target the different parts of your nervous system at the same time. The breathing techniques help activate your parasympathetic nervous system, the part that's responsible for rest and recovery and relaxation. At the same time, the acupressure provides your brain with calming, predictable sensory input that may help reduce nausea and dizziness while giving your brain something stable to focus on instead of focusing on the spinning. Think of one calming the alarm while the other helps reduce the chaos. Together, they're often much more effective than either one separately or alone. Let's imagine your Vertigo has just started. Maybe you rolled over in bed, maybe you bent down to tie your shoes, maybe you looked up in a cupboard, suddenly the room begins to spin. Your heart starts pounding and your breathing becomes heavy and shallow. Your brain immediately jumps to the worst case scenario. This is the moment to begin. Not 5 minutes later, not after you've convinced yourself something terrible is happening, as early as possible. Because the sooner you interrupt the panic cycle, the easier it is to prevent it from taking control. So the first part of the technique uses an acupressure point called the P6, sometimes referred to as the knee guen. I don't even know how to say it properly, but P6. Research has shown that stimulating this point may help reduce nausea in a variety of situations, including motion sickness, post-operative nausea, pregnancy-related nausea, things like that. While studies on the Vertigo are more limited, many people find it provides a calming effect during dizzy episodes. And here's how to find it. So turn one hand over, and so you're looking at your palm this way. Take your first 3 fingers of your opposite hand and place them right across your wrist like so. So you're gonna place your fingers on, so just below your actual wrist here, or before the hand, you're gonna place 3 fingers. Now, right beside your index finger, right in here will be a soft spot, and it's actually where there's a tendon here, but it's kind of right in between them. Now, I would use your thumb for this area. So I would actually push right here. Now, the goal here isn't to really push into it so it hurts. What you want to do is you just want to hold into that area, and you want to keep a little bit of pressure there. Again, you're not, if your thumb is going completely white because you're going nuts into there, well, that's a little bit too hard. Not enough pain, but you just want to push into that and hold that spot. So now let's calm the alarm system. Here's where breathing comes in. So I'm holding that spot on my wrist. One of the fastest ways to communicate with your nervous system is through your breathing. Most people don't realize that breathing is one of the very few autonomic body functions that you can consciously control. You can't simply decide to slow your heart. You can't directly lower your blood pressure. You can't instantly stop adrenaline from being released, but you can change your breathing. Kind of cool, right? And changing your breathing sends powerful information back to your brain. Think of it like sending a text message that says, "You're okay, buddy." As your breathing slows, your brain begins to reconsider whether the emergency is actually as dangerous as it was first believed. That's why breathing isn't just about getting more oxygen, it's about changing the conversation between your body and your brain. So now let's do this together. Continue applying steady pressure at the P6 point. Breathe in slowly through your nose for 4 seconds. So you're gonna now hold your breath for 4 seconds. 1, 2, 3, 4. Now slowly breathe out through your mouth. Again, 4 seconds. Now I want you to pause right at the end of that last breath with your lungs empty for another 4 seconds, and then repeat. Continue this pattern for 1 minute. So it'll be 4 seconds in, 4 seconds hold, 4 seconds out, 4 seconds hold, and repeat. What should you expect? Well, here's something that's really important. Don't judge success by whether the spinning instantly disappeared. That's not the goal with this at all. Instead, ask yourself these questions. Has my breathing slowed? Is my heart racing less? Are my shoulders beginning to relax? Am I feeling slightly more in control? Even if those changes seem small, They're incredibly important because they tell your nervous system is beginning to shift out of survival mode. Sometimes the spinning will improve, sometimes it won't. But even when it doesn't, your ability to cope with it often improves dramatically. And that's a huge win because once panic settles, you're much more likely to think clearly, make good decisions, and use appropriate treatments for the type of vertigo that you're experiencing. Here's something many people don't know. One of the biggest reasons panic feels so overwhelming isn't just adrenaline, it's your breathing. When people panic, they're almost always breathing faster without even realizing it. That rapid breathing causes you to blow off too much carbon dioxide. Now, this is the fascinating part. Most people think oxygen is the problem. It's actually less carbon dioxide that often creates many of those frightening sensations. And that's why if you ever had a panic attack and they said, grab a bag, put the bag over and you're breathing into the bag, well, you're building up carbon dioxide, aren't you? And when carbon dioxide drops too low, blood vessels supply the brain temporarily narrow. So those actual blood vessels will get smaller, and that can leave you feeling lightheaded, tingly, foggy, disconnected, as though you're about to faint. Does that sound familiar? Here's the problem. Most people assume their vertigo is getting dramatically worse. In reality, some of what they're experiencing may actually be the effects of hyperventilation layered on top of the vertigo. That realization alone can be incredibly reassuring because once you recognize the actual pattern, you can interrupt it. Why this matters before any vertigo maneuver, whether you're eventually going to perform the Epley maneuver or the half somersault maneuver, my favorite, or another repositioning actual exercise, getting the panic under control first often makes those treatments actually much easier to perform. Think about trying to follow detailed directions while someone is yelling in your ear, like when my kids are yelling in the back seat, I'm trying to drive. That's what panic does to your brain. It becomes difficult to think, difficult to focus, difficult to remember instructions. When your nervous system then settles, your brain can process information much more effectively. So don't think of this first technique as replacing the appropriate vertigo treatment. We're not doing that. Think of it as preparing your brain to respond to the treatment much better. We're actually setting you up for success. One thing I've learned over the years is that patients who actually understand why their body is reacting the way it is almost always recover emotionally faster than those who don't. When people realize my brain is trying to protect me instead of I'm dying, everything changes. They stop fighting every sensation. They stop fearing every episode. And that's often the beginning of getting your life back. But what if you're someone who panic doesn't seem to settle with that first technique? What if your nausea is your biggest problem? That's where the second technique actually comes in. It works a little differently. It targets different areas, and for some people, it's even more effective. So let's go through that one next. If your biggest problem during a vertigo attack is nausea or feeling like your entire body goes into overdrive, many people find this next combination even more calming. It combines another acupressure point called TW17 with a breathing method known as the 4-7-8 breathing. Before I show you exactly how to do it, I want to explain something that almost nobody talks about, because once you understand this, so many dizziness symptoms suddenly start making sense. Your brain is like an airplane pilot. Imagine you're flying an airplane through thick clouds. The pilot can't see outside, so instead the pilot has to rely completely on the airplane's instruments. Now imagine one instrument says that you're climbing, while the other one says that you're descending. A third says you're perfectly level. Would you trust any of them? Probably not. That's remarkably similar to what your brain is experiencing during many forms of dizziness. Every second of every day, your brain compares information from 3 major systems: your eyes, your inner ears, and your body's position sensors, which are found in the muscles and your joints of your neck. But some of the most important are found in the upper neck. So your brain constantly compares all 3. Normally, they agree. Your eyes say you're standing, your inner ears say that you're standing, and your joints and your muscles say that you're standing. Everything matches, so life feels stable. But if one system suddenly begins sending information that doesn't match the others, your brain has a problem. And then it has to decide, which one do I believe? That's when dizziness can occur. Here's something fascinating. The small joints at the top of your neck contain incredibly high concentration of tiny receptors called proprioceptors. Think of them as your body's GPS sensors. Every time you move your head, they're constantly sending information to your brain about exactly where your head is positioned in space. That information travels to many of the very same areas of your brain that also receive signals from your eyes and your inner ear. This is one of the reasons problems involving the upper neck can sometimes contribute to dizziness in certain people. In fact, I've had a lot of people come in from my videos, and the first thing I was able to find on most of them, believe it or not, most of them, was the atlas. That top bone was off. If those position signals become inaccurate, your brain may receive conflicting information. Now, that doesn't mean every person with vertigo has the same neck problem, and that's far from it. Many cases are caused by inner ear conditions like BPPV, vestibular neuritis, Meniere's disease, vestibular migraines, or other neurological conditions, even medications that you're taking. But for some people, the neck can be another important piece of that puzzle. And that's why it's so important not to assume that every dizzy person has exactly the same cause. One diagnosis does not fit every single person. Think of it like a 3-legged stool. Here's an analogy I often use with patients. Imagine your balance system is a stool with 3 legs. One leg is your vision, the other leg is your inner ear, and one leg is information coming from your muscles and your joints, including your neck. When all 3 legs are strong, the stool is stable. But what happens if one leg becomes weak? The stool wobbles. Now, imagine 2 legs aren't working properly. It becomes even less stable. Your brain is consistently trying to compensate for whichever system isn't performing well. Sometimes it does an amazing job. And to be honest, usually it does, because it took a long time for you to even get to this point. And other times, especially during illness, injury, stress, fatigue, aging, it simply becomes overwhelmed. That's when people often notice dizziness becomes much worse. I love this analogy because it helps explain why 2 people with almost identical symptoms can have completely different underlying causes. Now let's walk through the second technique together. This one combines TW17 acupressure point with the 4-7-8 breathing. To locate the TW17, you want to place an index finger right underneath your skull. There's a little bit of a gap here, and right behind your jaw. So it's going to be right in this area right here. For many people, this area is going to be surprisingly actually quite tender. Why? Because when the atlas, this top bone, is shifted, not turning or whatever, that's exactly where you're pushing. So if this is off, it's actually becoming more sensitive in this area, hence why I typically am adjusting that area on people with vertigo or dizziness. So for this point, I want you to apply gentle but steady pressure, and you're gonna do it on both sides. So you should kind of look like this when you're doing it. Remember, firm but not painful. Now keep that pressure there. Now what I'm gonna get you to do is put both of your fingers. So once you have those spots, you're gonna feel that area. It's gonna be firm, but not painful. Don't push into it and rub it. And keep that pressure there while we do the breathing technique. And you can follow me along as I do this. So we're gonna find those spots, the PW17, we're holding. I want you to inhale quietly through your nose for 4 seconds. So 1, 2, 3, 4. Hold your breath for 7 seconds. 1, 2, 3, 4, 5, 6, 7. Now you're gonna exhale slowly. And ideally you're gonna do it through pursed lips. So like that. For 8 seconds. Nice and slow. Now imagine you're slowly letting the air out of a balloon. So 1, 2, 3, 4, 5, 6, 7, and 8. And then you're gonna repeat this cycle 3 times. Don't rush it. Allow your shoulders to soften. Allow your jaw to relax. Notice whether your breathing feels easier than it did just a minute ago. Notice whether your body feels a little less tense. Remember, small improvements matter. So what if it doesn't work immediately? Now I know some of you are thinking, Dr. Posa, what if I'm still dizzy? That's actually a great question because many people expect any technique to work instantly. Sometimes it does, and often, let's be honest, it doesn't, especially from people on YouTube. And that's okay. These breathing and acupressure techniques are not designed to reposition crystals inside your ear. They're not designed to treat every cause of dizziness. Their purpose is something completely different. They're designed to help calm your nervous system so panic doesn't amplify your symptoms. Think of them as helping to regain the driver's seat. Once you're calmer, you're much better equipped to determine what type of dizziness that you're dealing with and what treatment is most appropriate. Now, one last important thought. Over the years, I've seen something remarkable. People who recover the best aren't always the ones with vertigo disappears the fastest. They're often the people who stop fearing every sensation. So just think about that for a moment. Fear changes how you move. It changes how you breathe. It changes how you think. It changes where you go or don't want to go. Eventually, it changes how you live. I've met people who have stopped driving, stopped traveling, stopped exercising, stopped going out with friends and connections, and not because the vertigo was happening every day, but because they were afraid that it might happen. That's a heavy burden to carry, and that's not living. And if that's you, I truly hope this video gives you more than just techniques. I hope it gives you hope, because understanding what's happening inside your body is often the first step towards taking your life back. But before we finish, there's one mistake I see over and over again, and it's incredibly common. Almost everyone does it, and without even realizing it, they accidentally make both the dizziness and the panic worse. Once you understand this mistake, it may completely change how you respond during your next vertigo episode. So this might be the most important piece, because even after dizziness improves, even after the spinning stops, even after the inner ear settles down, many people are left with something called fear of dizziness returning. And that is where the brain can actually keep the cycle alive. Think about this. Maybe you had your first vertigo attack while getting out of bed. You woke up, rolled over, and suddenly the entire room started spinning. Now your brain immediately went, something is wrong. Something dangerous is happening. I need to protect myself. That reaction makes sense. Your brain's number one job is survival. It does not care about the threat. Is a tiger chasing you or a confusing signal coming from your balance system? The alarm system responds the same way every time anyway. Your heart races, your muscles tighten, and your breathing changes. Your awareness becomes hyper-focused on every sensation in your body, and then something interesting happens. The next time you feel even a tiny sensation of dizziness, a small head of movement, a little imbalance, a strange feeling in your eyes, your brain remembers, oh no, this is happening again. And before you even realize it, the panic response starts. This is called a learned threat response. Your nervous system has connected a certain sensation with danger. But here is the good news. Your brain is also incredibly adaptable. And just like learned fear, it can learn safety. So one of the biggest mistakes people make after a vertigo is starting to avoid movements, stop turning their head, they stop exercising, they become careful with everything that they do. And I understand it. I had vertigo. I know what that's like. And I completely understand it. But when you have experienced true vertigo, movements can feel terrifying. But the problem is this: your brain needs safe movement in order to recalibrate. Your balance system is designed around the three major inputs: your inner ear, your eyes, and the sensors at the top of your neck at your C1 and C2. So because your brain needs accurate information, it needs practice, it needs repetition, it needs confidence. Avoiding movements tells your brain movement is dangerous. Controlled movements tell the brain, I am safe. This is why simple exercises can be so powerful. Not because they're magic, not because one exercise fixes everyone, but because they send a message to your nervous system that we can move, we can adapt, we can trust our body again. Even something as simple as slow head turns, or tracking an object with your eyes, which I've done in other videos, walking while turning your head, balance exercises, deep breathing while moving. All these techniques I've shown in previous videos. These are all ways of rebuilding communication between your brain and your body. Now I want to talk about something that I see frequently in my practice. Many people who struggle with dizziness are told their scans are normal, your ears look fine, your tests are negative, and they leave thinking, then why do I still feel this way? Or why isn't it gone? The reason is because dizziness is not always just about isolated structure. Balance is a neurological process. Your brain constantly is taking that information from different parts of your body and creating your sense of where you are in space. So your eyes, your inner ear, your joints, the muscles, your nervous system, everything has to communicate. And one area that plays a fascinating role is the upper part of your neck, specifically the upper cervical region. So these two top vertebrae, you have your atlas, your skull sits on top here, and then you have your axis, the other big one right here. And the simplest reason for it is because they have the highest concentration of those proprioceptor sensors and then in your entire body. These sensors provide your brain with information about where your head is positioned. Your neck is moving and your body is oriented in space. And if that information becomes distorted because of injury, posture changes, muscle tension, or altered joint mechanics, your brain may receive conflicting messages. And when the brain receives conflicting information from your eyes, your ears, and your neck, you can feel dizzy, off balance, or disconnected. This is the one reason why a complete evaluation, checking this, matters so much. You do not want to simply chase symptoms. You want to understand the communication system. In our office, when someone comes in with dizziness, we are not just looking at the symptoms, we are looking at the person as a whole. We evaluate posture, we evaluate spinal structures, we look at neurological function. We use advanced digital spinal scans. We look for patterns that may be affecting how your nervous system is adapting. And that's when we would deliver a chiropractic adjustment to the upper cervical spine or anywhere else that needs it in order to restore that communication. Now, I want to be very clear, chiropractic is not a replacement for emergency medical care. Like, they're not the same. If you have sudden severe dizziness, weakness, facial drooping, difficulty speaking, chest pain, severe headaches, or neurological changes, those require immediate medical attention. If you are clear after that, that's when you go to the chiropractor. But for many people dealing with recurring dizziness, balance issues, neck-related dizziness, or other nervous system, or a nervous system that feels stuck in a heightened state, chiropractic can be the solution. So step number one, calm the alarm system. Use your breathing, slow your breathing down, extend your exhale, tell your nervous system, I am safe. Step number two, give your brain better information. Use grounding, Look around. Name what you see. Feel your feet on the ground. Reconnect with your environment. Step number 3, restore trust through movement. When safe, begin gentle movement. Teach your brain that movement is not the enemy. Your body was designed to adapt. And if you're watching this video because you had experienced vertigo, I want you to know something. You are not alone. I have spoken with thousands of people over the years who have felt trapped by dizziness. Many of them stopped doing the things they love. They stopped traveling, they stopped exercising. They became afraid of simple movements. But the human nervous system is incredible. It can change, it can adapt, it can heal. The goal is not just to stop the spinning. The goal is to rebuild confidence in your own body again. If this video helped you understand vertigo and panic in a way that was different, do me a favor, hit the like button because it helps this information reach more people who are struggling. Subscribe to my channel because every week we talk about the nervous system, brain health, posture, spinal health, and natural ways to help your body function at its best. And I would love to hear from you in the comments. Have you ever experienced vertigo? Did you notice anxiety or panic after your first episode? I know I did. Or have you noticed that your neck seems connected to your dizziness? I hear that one a lot in all my other videos. Please share your story below because your experience might be exactly what someone else needs to hear. People feel isolated. And remember, your body is not broken. Your nervous system is designed to adapt. Understand the brain, the spine, and body communication. We can start giving the body the support it needs to function the way it was designed. And now, if you've ever tried the Epley maneuver and you found that it made your vertigo actually worse or simply didn't work, you may need a different approach. Go watch that video next. The Epley maneuver is making your vertigo worse. Do these 3 moves instead. I'll show you alternative repositioning maneuvers that I frequently use with patients and explain how they may help get your vertigo under control. Thanks for watching, and I'll see you on the next video.